Hello everyone, welcome to Pediatrics by Dr. Anand. This is the beautiful Unacademy NEET PG platform. Is my voice audible to everyone? Please put a message in the comment section. Thank you. It's a very important class. We're going to talk about it's one of the important videos which students were requesting. This is nothing but the video of the NRP, Neonatal Resuscitation Protocol. Yes, is my voice audible? Yes or yes, 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 yes. Exactly. I assume if my voice is audible. Hello Priya, hello Swaraj, Shubhangi Kaushik, Giri. Shubhangi, I'll send you, okay? I forgot. ठीक है आज कौन जीता आज शुभांगी जीती ना शाम को yes that's cute that's nice so has everyone what's happening क्या किया tell me everything कितना वो weight put on किया आपने I just now got my weight it's 85 I am perfect for my weight okay great hello Priya hello Swaraj hello Vaidehi what's up what's happening how's life and everything going. Great. Let's start the beautiful class. This is the Unacademy NEET PG platform. My name is Dr. Anand, and in this Unacademy NEET PG, we have this beautiful, like number one, which I would like to stress is nothing but very important. We have the what you call amazing subject-wise test. We have guys week 4, April 18 to April 24. I recommend every one of you to give tests anatomy, biochem, mixed test, anesthesia. These are the dates. Every day 10 p.m. we have this amazing test. If possible, try to give, it will be nice. Also at the same time, obviously we have another mock test happening happening on May 1st. So we have a mock test happening on May 1st, 9 a.m. It will be good. Give as many tests as possible because now as this is the exam time, I recommend you to give crazy test. Okay, also most importantly in the Unacademy we have something known as plus subscription and something known as iconic subscription. In the plus subscription, amazing access to the all the live and recorded classes. Educators are really good. You can watch me on your Android laptop and any device, and the test is good quality. That is the plus subscription. In the iconic subscription you get the Unacademy platform and the prep ladder subscription, all the amazing clinical notes, video lectures, question bank, everything you get on the iconic subscription. We have this new amazing feature known as Unacademy Lite. So basically it is light, it's for the light-hearted students. No, it's not for the light-hearted student, it's for everyone. It's a small basically pack basically because exam is so near. So it's a 1 to 2 month amazing batch for the NEET PG INI CT FMG students. Light rahe, light pack le, enjoy kare. Also we have started the batch for the MBBS Prof 1 pertaining to next exam. The batch has already started. If you're a newcomer, you can use the code Dr. Anand and enroll into this amazing MBBS Prof exam series. This is the duration, price and pre-launch price for taking this pack. Also NEET PG previous year question bank. We have a dedicated section of PYQs. Like of course PYQs everything, okay, everyone keep asking, sir please tell me top 10 important topics of pediatrics. So last 3 year question papers are the important topics of pediatrics. Okay, so that's one. Go to Unacademy app, click on the self-study option, click on the practice and take the subject. You'll get the amazing PYQs. Okay, it's important. Also, every day I'm launching this DPP, daily practice papers, for enhancing your conceptual understanding. I hope you're taking that. On the Unacademy, if you're a newcomer, download Unacademy app. In that, we have make amazing MCQs poll. You never miss the classes because all the lectures are recorded and PDF notes is something which you get. Okay, we have already made this amazing batch of FMG Hild Revision MCQ batch. April 27 to May 27 for the live interactive classes, PDF notes and the question bank. It's nice. Also, that's it. So let's start the class. I told you regarding the plus, iconic and light subscription. The light test is the 2 months light subscription. All you have to use is any educator's code, and my name is Dr. Anand, so you can use any code. The code is Dr. Anand. Perfect. Yes, let's start the classes. Yes, हेलो निशी अग्रवाल, हेलो दीपक. दीपक भी आजकल आ रहा है. दीपक आजकल आप क्लासेस आ रहे हैं, क्या बात, तबीयत ठीक है आपकी? So okay, let's start this beautiful mind-blowing class. So before starting any amazing segment, we always have a motivating quote, and this is a very beautiful quote. The quote says, "But the fact is there is nothing ordinary about you. But the fact is there is nothing ordinary about you. You have a fingerprint that nobody else has." So what do you think, guys? Is this a motivating quote? Yes or no? I think it's beautiful quote. This is such a simple but yet important thing. Tell yourself, You are not ordinary, you are unique, you are amazing, you are super, super, super special. Okay, and that's the fact. Okay, but the fact is, there's nothing ordinary about you. That's the most beautiful part. There is nothing ordinary about you. Every single thing about you is $1,000,000. Okay, and you have a fingerprint that nobody else has. Do you agree with this? Yes or no? And that's a fact only. We have a fingerprint no one else has. So are we unique? Yes, we are unique. There's no doubt about it. Today's topic of choice is nothing but neonatal resuscitation protocol. Many of our juniors are requesting to take this topic. If you're a newcomer, that's great. If you're an old comer, then keep answering whatever if I ask you questions. Neonatal resuscitation. Let's talk about it, okay? It's an amazing one. Exactly. Yes, exactly. क्या है एफएमटी का वन लाइनर है ये कोट यस yes, that's right, bro. चलो, neonatal resuscitation. Okay, a newborn baby has come, like you'll got so Deepak, you were there with me in the night duty. So Dr. Deepak, are you there or you are not there? You're there. Okay, so guys, this ID combat healer, his name is Deepak. So yes, so you were there with me in the night duty and you got a call. You got a call from the labor room. You got a call from the labor room that Dr. Deepak, one delivery is going to happen, like one cesarean LSCS is going on and one baby is going to come. Please come to the labor room, right? So Dr. Deepak, once you enter the labor room, what is the one thing you'll do, bro? You want to chit chat with sisters? You want to ask her out? Saturday, what are you doing? Let's go somewhere, no? Or you want to do something? What do you want to do? Tell me. Exactly. It's a 30 minutes class, 9:30. I'm gonna stop it. Okay, it's a part one. Hanji, Dr. Deepak. Dr. Deepak, are you there? Dr. Deepak is sleeping. Okay, cute. It's good time to sleep. I agree with you. Exactly. So, okay, Shubhang, again, listen to me very carefully. Put your good vibes, strongest vibes. I want positive vibes. I want for this classes. Okay, so again, my question is very simple. My question is that, you got a call from the labor room that a delivery is going to happen. You entered the labor room. What is the first thing you will do? Anyone, anyone, anyone? Okay. Okay, yes, I think before Shubhangi saying Somya has the right answer. Okay, so Somya has the right answer. I most importantly, once I enter the labor room, do you want to check the temperature of the labor room? Yes or no? The first thing is nothing but you will check the temperature of the labor room. What is the ideal temperature of the labor room? Who will tell me? Okay, Amrit Sehu said hand wash first. Okay, I agree with you. How many steps of hand washing is there? I have so many million questions to ask. I'm so happy. So much I have read that I feel like asking question for everything. How many steps of hand washing are there? Hand washing is done for how many minutes and each step is done for how many seconds? This was the question asked to me actually. So anyone, what do you think? मेरा charger काम क्यों नहीं कर रहा? 1 second. Let me put my charger. Why it's not working? Okay, 1 second. It should work now. Yes. What do you think? Anyone? Anyone? Hanji. Yes, that's very well put. So yeah, hand washing. That's where there's a beautiful answer, bro. Hand washing is done for what you call the 2 minutes. Hand washing is done for 2 minutes, and each second there are 6 steps of hand washing. Number one, there are 6 steps of hand washing. Hand washing is done for 2 minutes, and each step is done for 20 seconds. हाँ 2 6 12 120 seconds. Yeah, exactly. चार्जर क्यों काम नहीं कर रहा? कम वक्त चार्जर क्यों काम नहीं कर रहा? 10% battery. What to do? What to do? Everyone, what to do? Okay, 1 second. Let's see. Let's see. Okay. Great. So let's start. Let's finish it off fast. Only 30 minutes. Let's see if my laptop helps with us. Okay. Yes, perfect. So the answers for the question is nothing but hand washing is done for 2 minutes. That is the first thing. How many steps of hand washing are there? There are 6 steps of hand washing according to AIMS protocol, and each step is done for how many minutes? Each step is done for 20 seconds. Obviously, each step is done for 20 seconds. Total 6 steps are there. 6 into 2 is 120, means 120 seconds means 2 minutes. Has everyone understood this part? Hand washing is done for 2 minutes. Total 6 steps are there, and each step is done for 20 seconds. This was the question asked to me by my HOD in our NICU. Whenever we enter the NICU, HOD always ask this: what are the steps of hand washing, how many minutes you do, and how do you do? Perfect. Okay, great. Now coming to the next one. So Dr. Deepak, once you enter the labor room, the most importantly, number one, you check the temperature of the labor room. So what is the ideal temperature of the labor room? Who will tell me? Yes, the ideal temperature of the labor room is 25 degrees Celsius. The ideal temperature of the labor room, or some book says 25 to 28 degrees Celsius. Do you want to check anything else, Dr. Deepak? Yes. Hi, Arpita. Anything else you want to check? You entered the labor room. You check the temperature of the labor room. There's one delivery going to happen. You did hand washing very well. That's very nice. Anything else? Are we missing anything else, guys? What do you think? Put your answer in the comment section. Are we missing something, or that's it? That's enough. The baby is going to come. The baby is just going to come, bro. Do you want to do anything else? Incubator. Before incubator, do you want to on the neonatal warmer? Have you heard of neonatal warmer? Yes or no? Do you want to on the neonatal warmer? Exactly. Shubhangi is very right. Number one, this neonatal warmer should be ready, should be on. Number one. Number two, do you need a oxygen pipe? I told you very important. I told you very important. Oxygen is really important. Do you want to have a suction catheter? Maybe if the baby not cried immediately after birth? Yes or no? Maybe the baby is having a lot of secretions in the mouth? Yes or no? And also, see this also very importantly. Welcome to Pediatrics by Dr. Anand. Yeah. So this is me only, the handsome boy. And also, can you see behind this one? ये वाला क्या है ये? What is this, bro? What is this? Deepak, क्या है ये? तुम्हारे घर का नक्शा है ये? क्या है ये? This is very important. Suction catheter. This is the suction catheter you need to know. This is a suction device basically. This is a suction device, and this pipe, ये वाला pipe, this pipe is nothing but the suction pipe. This whole thing is the suction pipe connected to the baby. So it's important. Okay, this you should know. Okay, so number one, oxygen should be ready. Suction should be ready. Suction pipe, everything should be ready in this one, in the baby. And there's a warmer also. I think I have the warmer. This I'm standing on the warmer, or not on the warmer, near the warmer. Okay, so these are the things you should be ready. And also very beautifully Soumya Namrata answering, you need to have all the other equipments also. Yeah, very good. What are the other equipments required? Of course, you might need a bag and mask ventilation. Will you need any drugs? Yes or no? Yes, you need adrenaline, very important. And okay, and what else you want to need? Yeah, do you need a laryngoscope? Yes or no? Yes, you need that. Yeah, so these are the important points or instruments. Basically, if I ask you again this question, that once you enter the labor room, baby is going to come, what? So you will say equipments check. Can I write this single word which explains everything? Equipments check. Yes or no? Okay, perfect. I want you guys to have a as realistic approach as possible. Okay, it's important. Okay, perfect, very good. Okay, yeah, so now it's charging. So yes, perfect. What else? Okay, what is the other thing? The baby is 30 seconds left. The baby is just going to come. Can you please tell me fast? Equipment is ready. My ambu bag is ready. Laryngoscope, one side oxygen, one side suction, and most importantly, this amazing neonatal warmer. बच्चा अपने सर पे तो रखोगे नहीं, ठीक है? You'll not put baby on your head, right? Where will you put? You'll put the baby on the neonatal warmer. Do you want to do anything else, or is it done? Akash, Target aims, Swaraj, Srujana. What is anything else? What is the next step should I do? Everything is ready. What is the next step should I do? Hanji, Srujana, what do you think? The most important part which you have missed right now is, do you I told you, see, that's what your eyes can't see, what your brain doesn't know. Your eyes can't see what your brain doesn't know. So examiner told you LSCS was going on. Don't you want to know the indication of LSCS? Yes or no? Every mother LSCS is done, or normal vaginal delivery is done? Every mother normal delivery is done, right? But this could be some critical case. That is why LSCS is done. Do you want to know which gravida? Do you want to know which para? Do you want to know which living? Do you want to know any abortion history is there or not? Yes or no? Do you want to know all those things? So gravida, para, living, and abortion is very important, of course. This is what you need to understand. And also at the same, maybe it is a twin pregnancy, yes or no? Because if there are two babies coming, two pediatricians are required. If there is one baby coming, one doctor is required. Two baby coming, two doctor is required. Okay, maybe it's a case of IVF, in vitro fertilization. Maybe she's a gravida, 42-year primary gravida, which basically got a 7 lakh rupees she has paid, and she has got a IVF done, and they have come to this hospital for cesarean section. Do you understand? Yes or no? Very importantly, right? Exactly. Okay, Deepak is full mood. Deepak is in full mood. Deepak is saying on call pediatrician का फोन ऑन है कि नहीं? तो बहुत क्यूट, अमेजिंग आंसर्स. तूने कुछ और भी कहा था पहले, तू कुछ पंगा लिया था पहले, मैं पढ़ नहीं पाया. एनआईसीयू में बेड है कि नहीं? That's very well put actually. Yes, that's very true. If there is a cesarean section going on and baby is a pre-termer or a post-termer or a diabetic mother, do you want to check the bed availability? Yes or yes. The answer is बड़ा बड़ा चेहरे पे लिख लो. Yes, definitely done. Perfect. Amazing. So yes, so everything is set. Now the next question is बच्चा आ गया, ठीक है? The baby has come. Baby came. So PG entrance question number 1. If the baby has come, what is the first thing you will do? What is the first thing you will do? Akash Chauhan, पांचल, शुभांगी, डॉग डॉम, सृजना. कितने सुंदर सुंदर लोग आए हैं. Okay, so yes, baby has come. What do you want to do? You want to play with the baby? टिक टैक ऐसे खेलें, बच्चे के साथ खेलें. For you want to have a selfie like this with the baby? Yes or no? लड़कियां तो ऐसे पाउट करके ऐसे करती हैं. Getting आकाश कह रहा है getting nice vibes boss. Yes boss bro, same here. Akash, you're a part of our group, right? We have this amazing groups. Yes, the first thing you will see is very importantly number 1, TTC. Very beautifully, मोती की तरह सब clear होना चाहिए. The baby has come to me now. Everything I have done, the baby came. The baby came, the first thing I will do is the term, tone, and cry. Yes or no? What are we studying? The today's topic of choice is NRP, right? NRP. What is NRP? Neonatal Resuscitation Protocol, right? So what is the first thing you will do? Bacha roya ke nahi roya. I always tell you that my HOD told it's better to give no baby than giving a bad baby. It's better to give no baby than giving a bad baby. Just because of people like you who have half knowledge of what to do if the baby has not cried immediately after birth, it is very important. Okay, baby must cry immediately after birth. If the baby do not cry immediately after birth, the golden 1 minute is really important for me. I need to make sure that the baby cry immediately after birth. Otherwise, the baby can go into irreversible brain damage. Yes or no? Can the baby later, he can be a case of CP? What is CP? Cerebral palsy. Yes or no? The baby can throw seizures also. Do you agree with me? Yes or no? So it is important. My actually told it's better to give no baby than giving a bad baby. So that's what. So what is the first thing you will do once the baby comes? Sir, I will check term है कि नहीं है, tone कैसा है, cry कर रहा है कि नहीं कर रहा. Term, tone and cry is the first thing I will see once the baby comes. Okay, term है कि नहीं? डॉक्टर दीपक आगे आ जाओ. कुछ नहीं कहूंगा, मारूंगा नहीं, कुछ नहीं मारूंगा तेरे, तू आगे आ जा. डॉक्टर दीपक, could you please tell me? Yes, once again I'm just finding a empty page. How do you differentiate term baby from a preterm baby? डॉक्टर दीपक, could you please tell me? और तूने अगर नहीं बताया ना, देख चप्पल कहाँ है मेरी, यहाँ रखिए ये चप्पल पड़ी है यहाँ पे. हाँ जी, साइज 9 नंबर साइज है मेरी चप्पल का. Do you want to try anything? हाँ जी. So yes, my question is term है कि नहीं, right? The first thing we're gonna see is baby is term or not. How can you clinically tell that this baby is not a preterm or not a post-term? It is a term baby. Can anyone please help me? I really forgot. I don't know what is preterm and post-term. Exactly. So we have Kostub, Soumya, Arpita, Dog Dum. Amazing people answering. Exactly. If the baby is less than 37 weeker, the baby will be a preterm. 37 to 41 completed weeks will be a term baby, and more than 42 weeker will be a post-dated or a post-term baby. Everyone आंसर्ड एक्सेप्ट दीपक. जिससे पूछा था वो तो भाग गया, बाकी सब ऐसे आंसर कर रहे हैं. हाँ जी, कहाँ है दीपक? कहाँ है दीपक? कहाँ है दीपक? इधर आजा. नहीं, कुछ मारूंगा नहीं, आजा इधर, आगे आजा. हाँ जी, आंसर कहाँ है? आंसर किधर है तुम्हारा? ओके ग्रेट. Again, yes, you can say that. I'll repeat again. Every single word should be counted. Okay, it's important whatever I'm saying. I said once the baby comes to me in a neonatal resuscitation protocol, what is the first thing I will see? Term, tone, and cry. है ना? Term, tone and cry. My question is, how do you differentiate यार that this is a term baby, not a preterm or not a postterm? Anyone? हाँ जी. So yeah, exactly. The answers to this question is number 1, I will do something known as ENBS. What is this ENBS? Yeah, I don't know what is this. I will do something known as expanded new Ballard score. Have you heard this name, Ballard score? Number one, Ballard score is done for which to which weeks, baby? Can anyone tell? Soumya has already very beautiful told 20 to 44 weeker baby. I can assess that baby through Ballard score. From a 20 weeker baby to 44 weeker baby can be assessed by the Ballard score. And if the baby is exactly 20 weeker, the Ballard score, the score will be -10. And if the baby is 44 weaker, the maximum score will be 50. Again, these are very important question. PG entrance question number 1. What is the lowest Ballard score? The answer is -10. What is the highest Ballard score? The answer is 50. What is the lowest gestational age which I can detect through Ballard? 20, and 20 to 44 weaker. I can get to know what are we talking about? Gestational age. Matlab the baby is preterm, term or post-term baby. Has everyone understood this much? Yes or yes, yes. Okay, Meena says, good evening, sir. Sorry for joining late. No problem, Meena. We have 12 more minutes. 9:30, I'm going to finish this class because we're going to take YouTube session for 30 minutes so that everything, you get very strong vibes and you can put your maximum output. The next class of this topic only will be tonight, 11 p.m. So 11 p.m. also, if you guys are free, please come for 30 minutes. We'll chit chat. ठीक है, दो चार तुम्हें सुनाऊंगा, फिर अच्छा लगेगा, फिर क्लास हो जाएगी. ठीक है, perfect. चलो जी, हाँ जी, done. Okay, and what an extra points which Shubhangi I was expecting from you is Ballard score name everyone knows, dear. I was asking you, when the baby come, what will you see? You said term, tone, and cry. I said, how do you know it's a term baby? So Ballard score of course will do, but important sub points are: number one, will you see the baby's scalp here? Yes or no? Term baby ka, how is the scalp here? Do you remember SSS? Smooth, silky, and shiny will be a term baby. Otherwise, preterm baby. What else? Can you go to the breast nodule? Yes or no? Breast nodule more than 5 millimeter will be a term. Less than 5 millimeter will be a preterm. Third important point, sir, clinically I saw something known as lanugo. What is lanugo? Is lanugo more common in terms or more common in preterms? Yes, lanugo is abundant hair at the shoulder and the back. सर के बाल, सर के, दीपक कहाँ है? दीपक नजर नहीं आ रहा. दीपक कहाँ? दीपक तू नहीं नजर आ रहा मुझे. ओसामा भी नहीं आया आज. आई थिंक ओसामा बिजी होगा. Exactly. Dr. Benedict, beautiful. So lanugo is abundantly seen in preterms. Number one, lanugo is abundant hair at the shoulder and the back, seen in preterms, not in terms. So I can appreciate a term baby from a preterm baby. The points are: term baby, number one, scalp hair, number two, breast nodule, number three, lanugo, number four are genitals, and number five is plantar creases. Every single word is so important, bro. I can't tell you. Plantar creases. And exactly, Hanji, Meena is right. Preterm baby will have more lanugo. Or dear, you can just say term baby, lanugo is absent. More or less, nahi. Lanugo is abundant hair at the shoulder and the back, seen in preterms, not seen in a term baby. In a term baby, you will have a lot of beautiful, smooth, silky, shiny scalp hair, but you will not see any lanugo in a term baby. It is as simple as that. है ना? More or less नहीं है. Present, absent, finish. Okay, and plantar creases. And very important one thing, can I also mention palmar creases in a जगह ही नहीं है. Can I also mention palmar creases in a Ballard score? Yes or no? Can I say palmar creases? Palmar creases present will be a क्या बोलते हैं उसको, term baby, and palmar creases absent will be a preterm baby. Is this line yes or is this line no? What do you think? Yes, beautifully told by amazing, amazing, amazing. Yes. So Farhan says, sir, बहुत मस्त पढ़ा रहे हो आप, positive vibes आ गई all the goes around. Yes, that is the only journey. Life is all about positive vibes. Life is all about positive vibes, being positive. If you're happy in your daily routine, you are successful. Remember this always. Okay, if you're happy reading this topic, you are a successful person. What is a successful person? Everyone jumps, I want to be successful. What do you think? Money, having a BMW? Wैसे I have a BMW, that's a good part. But what is successful? If you're happy in your daily routine, you are successful. If you're happy right now reading this topic with me, you are a successful person. Always remember that. Okay, and मुंह बना के पढ़ोगे तो मुंह बनाए हुए नंबर आएंगे, ये भी याद रख लेना. Exactly. हाँ जी, दीपक कहाँ है? हाँ दीपक, अच्छा अब तू आ गया रिप्लाई करने के लिए. जब आवाज बोला था तब तो चक्कर खाए गिर गया था तू. हाँ जी, एग्जैक्टली. Yes. So my question is Palmer creases. If I say Palmer creases present and Palmer creases absent, can I differentiate term and preterm? The bada answer is no, 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 no. It is only the plantar creases, bro. Remember, this was a PG question. Are you understanding? This scalp hair, breast nodule, क्या बोलते हैं, lanugo, and क्या बोलते हैं उसको, genitals, and the Palmer and plantar creases. The plantar creases are the one differentiating from preterm and term, but not the Palmer creases. Palmer creases is not a part of the Ballard, and Palmer crease you don't differentiate कि बाबा Palmer crease Palmer creases present will be a term, otherwise preterm. No, only plantar you will mention. ठीक है समझ में आ गया अवकाश? Okay, great. Let's move further. So yes, so again, once I enter the labor room, what is the first thing I will see in the baby? Term, tone and cry. Term, tone and cry. हाँ जी डॉक्टर दीपक आगे आ जाओ. दीपक कहाँ पे है? हाँ जी ठीक है. यस दीपक कह रहा है सर मैं शुभांगी से टॉपर से ज्ञान ले रहा हूँ. गुड, अच्छी अच्छी हैबिट्स है ये. ओके ना माय क्वेश्चन इज बेबी इज क्राइंग. बच्चा दहाड़े मार मार के रो रहा है. बेबी इज क्राइंग नाइसली लाइक दीपक क्राइज लाइक दैट ओनली बेबी क्राइंग. सो डॉक्टर दीपक व्हाट विल यू डू? यू आर देयर विद मी इन द नाइट ड्यूटी. तो भागता है बहुत नाइट ड्यूटी से भागता है बेटा, तो जान से मार दूंगा तेरे को अगर भागा नाइट ड्यूटी से. तो डॉक्टर दीपक द बेबी इज क्राइंग नाइसली ब्रो. व्हाट डू यू वांट टू डू? You want to take a selfie with the baby? You want to do something? What do you want to do? Who will tell me? Exactly. Yes, yes. So if the baby has cried, what do you think? What do you want to do? मैं नहीं बताऊंगा. I will not tell. You only will tell me. If the baby has cried immediately after birth, what to do? गोद में खिलाऊं बैठ के उसको? क्या करना चाहिए मुझे? What should I do? Exactly. Meena says, seriously, sir, your way of teaching is just awesome. Thank you, ma'am. I'm nothing without your support. The answer is, what is the answer? Hanji. So someone says cord, clamp and cut. Someone says dry the baby. Okay, that's a beautiful answers. But can I say only one line something known as routine care? Yes or no? Routine care is a 5 marks question for MBBS students. Basically, what is routine care in neonatal resuscitation? Are you understanding? Routine care. So routine care में 25 बात जो बोलना है करो. routine care में cord, clamp and cut. Will you cord, clamp and cut? Yes or no? So umbilical cord, how many artery, how many veins we have? Who will tell me? Let's see if I have a picture of umbilical cord here and there. Let's see. Okay. No, it's not there. Yes. So umbilical cord, what do you think? How many arteries, how many veins? I think that's a very simple question, I guess. Yes, we all know about it. 1 second. कहाँ गया वो page? Exactly. So yes. So I'll कहाँ वो page? 1 second. Yeah, this one. So routine care. What is routine care? Cord, clamp and cut. How umbilical cord, clamp and cut. And everyone knows we have 2 artery and 1 vein. 2 artery, 1 vein. If the patient has 1 artery and 1 vein, you will think of that also is already over. If the patient has 1 artery, 1 vein, you will think of renal agenesis. That's an exam question. Every single word is an exam question. So I'll repeat again. If the baby has cried immediately after birth, I will do routine care. Clean the baby. And do you suction every baby? Do you suction every baby? Yes or no? You want to suction every baby? Yes or no? The answer is no. You don't suction every baby. Suction if required. Suction if required. Bhaiya, remember that. You don't suction every baby. Putting any pipe in the baby's mouth is like inviting infection to the baby. Okay. So I'll repeat again. The last 1 minute left. Then this class is over. If the baby has cried immediately after birth, क्या करना है? You will do routine care. कहाँ चला गई? तो हाथ मेरे ऐसे चलते हैं ना. हाथों में जादू है मुझे लगता है. हाँ, so you will do routine care. What is routine care? Number 1, suction if is क्या बोलते हैं? Suction if required. Yeah, routine care means suction if required. Cord, clamp and cut. Put the baby on the mother's abdomen. And last one. क्या बोलते हैं उसको? Do you give any injection to the baby? It's 9:30. The class is over. Do you give any injection to the baby? Nishi Agarwal, Shubhangi, हाँ जी. Shubhangi, remember if you are suctioning, okay, I agree with you. Shubhangi says, see, remember if you are suctioning, if you have to suction, then of course Shubhangi is right. Alphabetically M come first and then the N. Nothing but you suction the mouth followed by the nose. If you have to suction, question number 1, do you suction every baby? No. If you have to suction, what do you want to suction? Mouth followed by the nose. Do you suction the trachea? The answer is no. Tracheal suctioning is never done. Tracheal suctioning is never ever done. one part. अच्छा क्या था injection, हाँ. So that's it. There are two injection we should know. Number one is vitamin D and one is vitamin K. Vitamin D, yes, Soumya is already right. Vitamin K we give injection. If the baby is less than 1 kg, we give 0.5 milligram. If the baby is more than 1 kg, we give 1 milligram. And what about the vitamin D, anyone? Vitamin K at 9 months? No, Taleshwar, not 9 month, bro. Vitamin K is given at birth only. And what about vitamin D? Yes, 400 international units for a term baby and 800 international units for the preterm baby is the dose of vitamin D. Vitamin D is given syrup and vitamin K is given injection. सुई लगाएंगे, yes, injection. That finishes 30 minutes of this class. Thank you so much for the participation, and see you tonight again at 11:30 p.m. No, not 11:30, 11 p.m. basically, 11 p.m. with the other questions. Basically, if the baby has not cried immediately after birth, what you should do, what is the pressure required for the pop-up valve, and many other questions. So that's it. Vitamin K, bro, Akash, less than 1 kg, 0.5 milligram, more than 1 kg, 1 milligram intramuscular is given vitamin K. Thank you so much everyone for this participation. Have a wonderful evening ahead. See you tonight at 11 p.m. again. You'll get the link in your messages, and see you. Thank you so much. And before leaving, always remember this beautiful quote. It's going to be hard. I know it's going to be very hard, but hard does not mean impossible. It's going to be hard, but hard doesn't mean impossible. Good things take time. Good things take time. So thank you so much everyone for this wonderful participation. Akash, Mansi, Priya, and our Deepak, Anamika, Shubhangi, and amazing students. See you tonight, 11 o'clock, same this channel, Unacademy, and we'll discuss the other set of 30 minutes of questions. Thank you. Bye bye.